Well, hi there. My name is Dr. Michael Platt. I'm with the Platt Wellness Center in Palm Desert, California. Anyway, what we're going to be talking about today are some hormonal issues that are connected to pregnancy and what happens after the pregnancy. So let me begin with morning sickness, which is a relatively common phenomenon and which occurs during the first 3 months of the pregnancy, and morning sickness at this time is due to problems related to excess estrogen. Going into the second trimester, the placenta starts pouring out progesterone, and progesterone is like an anti-estrogen hormone, so the morning sickness attributed to estrogen goes away. However, there are some women that continue to be nauseated and even vomit throughout their entire pregnancy. And the cause of this is actually unknown to the medical community, especially gynecologists, but the cause is actually attributed to increased adrenaline during this period of time. And so obviously the approach here is not only to reduce adrenaline, but also to provide the means of doing this. Now, it's sort of unfortunate when it comes to our medical system that doctors are not trained, for the most part, in treating the cause of illness. And so that's why we have so many conditions that are felt to be incurable, because doctors don't treat the cause. Now, again, when a problem is related to excess adrenaline, one needs to approach it from the reason why the body's putting out adrenaline. A lot of people know of adrenaline as the fight or flight hormone, and which it is. But when people are in danger and the body releases adrenaline, this only happens for a very short period of time while the danger persists. And as soon as the danger goes, the adrenaline levels go down. But there are some people that are putting out adrenaline all day and all night, and for a different reason. And this reason, people don't really understand what adrenaline does. And its main function, the main function of adrenaline, is to make sure that the brain has fuel. And, because without fuel, the brain doesn't function. A classic example of this is when people get sleepy between 3 and 4 in the afternoon, or sleepy in a car. They call this hypoglycemia, a low blood sugar. But when you take sugar away from the brain, it falls asleep. So the primary function of adrenaline is, again, to raise sugar levels for the brain. So anytime the body detects that the brain is running out of fuel, it simply puts out adrenaline to raise the sugar levels back up again. Now the sugar that we're talking about is glucose, and the process by which adrenaline raises glucose levels, it's called gluconeogenesis. And it's mediated, again, through the sympathetic nervous system, which is adrenaline. Now the other fuel, which is at least as important, if not more important to the fuel, are ketones. And basically, you don't have to go on a ketogenic diet to get ketones. The simpler way is just to use coconut oil or MCT, medium chain triglyceride oil, which and the coconut oil converts into MCT oil, and MCT oil converts into ketones. And ketones go directly into the brain. They don't need insulin. Glucose needs insulin. So it's a direct way of getting fuel directly into the brain. So that a woman who is vomiting throughout her entire pregnancy, first of all, the main, or not the main thrust, but half of the main thrust is providing the right fuel, which means vegetables for the glucose and coconut or MCT oil for the ketones. And that is something that needs to be done throughout the entire day, not just in one meal. And now the other part of the treatment, which is just as important, is adding progesterone. Even though the placenta is putting out progesterone, it's obviously not enough to block the adrenaline. So one needs to add progesterone to this, and a 5% progesterone cream is the exact strength that somebody needs to block adrenaline. So the combination of these two two things, the eating correctly and using the progesterone cream, will eliminate the what's called hyperemesis gravidarum, or vomiting throughout the entire pregnancy. Now, after the pregnancy, another hormonal issue arises, which is called postpartum depression. And now keep in mind that when a woman is pregnant, the placenta is pouring out progesterone, and progesterone is a natural antidepressant. It's very close to what are called an MAO inhibitor type antidepressant. And this is why a lot of women actually feel good while they're pregnant. But as soon as the baby is delivered, that progesterone level plummets. And there are a lot of women after this drop in progesterone will develop what's called postpartum depression. Unfortunately, the approach to this treatment is to treat it with antidepressants, and some doctors put women on estrogen, which does absolutely nothing. But logically, it would make more sense to give the woman progesterone, which actually eliminates postpartum depression. Now, interestingly, there are some babies that develop what's called colic. These are babies that are crying shortly after the birth, and obviously they're in distress. And the colic is also caused by excess adrenaline. And I suspect, going back to postpartum depression, that part of this, the postpartum depression, is also related to excess adrenaline, because adrenaline is an anger hormone. And one of the most common causes of depression is internalization of anger. So I suspect that postpartum depression and colic in the newborn are sort of closely interrelated and both related to adrenaline. In any event, if you have a baby with colic and get hold of some 5% progesterone cream and rub it on their belly, probably in about 3 minutes, the colic is gone. So this way you don't have to stay up all night with a crying infant. Sort of tangential to this, later on, if you have a child that develops bedwetting, bedwetting is also related to adrenaline. And giving that child the right nutrients for the brain, which is glucose from vegetables and coconut oil or MCT oil for the ketones, and using progesterone cream, you can actually eliminate bedwetting in 24 hours. For those people that want more information about adrenaline and all the conditions that it's related to, I've written a book called Adrenaline Dominance. It's available on my website, plattwellness.com, or on Amazon. It's the only book that has ever been written that talks about the clinical consequences of too much adrenaline. I think you'll find it very interesting. There are many conditions like ADHD and fibromyalgia all related to excess adrenaline. The other thing is that you can also obtain a 5% progesterone cream, which I had specially formulated, again, on my website, www.plattwellness.com, or on Amazon. It's called, Platt Pro 5% progesterone cream. And this way, it's sort of putting you in a position where you can actually take care of your problems without having to rely on a medical system that, unfortunately, is not geared toward getting you better. Anyway, thank you for listening.